Hello, Mrs. Jones. How are you today?
I'm good. How are you?
Good. My name is Lachey. I'm going to be your caregiver today, and I'm going to just take some vitals if that's okay with you.
Okay.
All right. Start by washing my hands. My gloves on. How are you feeling?
I feel good. I'm a little cold.
Yes, it is very cold in here. Okay. For the temperature, we want to take and place the probe on. And then we're going to change this to oral, right? And then we're going to place it underneath the tongue. Go ahead and close your mouth for me. Okay, and so we got 99.9. I'm going to dispose of the probe. Make sure that I clean my equipment. In this case, we would have the patient make sure that the armpits are clean and dry. And then we would place the probe on again. We would make sure that we're making sure that we touch the skin. And also on this, we would also make sure that this is set to axillary. There, it is now set to adult axillary. And then we're just kind of going up. And it is now measuring. So in this case, it's 35.5 C. I will convert this to Fahrenheit, making sure that I clean this off. Now, if this were a red lined or a red capped thermometer, that would mean that it is for the rectum. And if we're going to take a patient's temperature rectally, what we want to do is we want to make sure that we have the patient lie in the left Sims position. And then we also want to make sure that we lubricate this bad boy before we insert it. And for an adult, we would just insert it 1 to 1.5 inch, which would be about to the end of my thumb here, right? Okay, so let's just say that this is 1. We're lubricating our thermometer. Here's the anal, and we're going up towards the belly button, would you say? And then we're just gonna put it in there, 1.5. After we are done taking the rectal temperature, we want to make sure that we clean the patient up. And then we also want to make sure that we clean this off. We want to make sure that we wash our hands after every encounter. So now what we're going to do is we're going to take her temporal temperature. So we're going to have her remove her glasses. Gonna make sure that this is always cleaned in between uses. And then what we're gonna do is we're gonna take this off. We're gonna hold the scanner. And we're just gonna go behind her ear. And we have 97.3. Now, it is a little bit colder in here, so I would expect to get a temperature in this range. And also, I do want to mention this, that I would also make sure that before I take this temperature, that her forehead is dry. And also, if she has just come out of a cold temperature setting, I would also make sure that we just wait a few minutes just for her to warm up. And that's that. And then we're making sure that we clean this off. For tympanic temperature, we don't have the equipment, but we would make sure for an adult that we are pulling the pinna up and back. So I'm going to see if I can show her here. So we would do it up and back. We would assess, making sure that her ears are dry. And then check that, clean up our equipment. Hello, I am back and I am here to check Lindsay, which is my patient. I'm here to check her oxygen saturation, and while I'm doing that without letting her know, I will also be assessing her respiration rates. So I'm going to just start with performing hand hygiene. I will place some gloves in this case. Have this. We're going to make sure that this is working properly, and it is. We're going to make sure that the client's hands are nice and warm. And then we're also going to make sure that there is no fingernail polish. If there was fingernail polish, we would either remove it and then assess. In this case, she does not have any nail polish on, so we're just going to pop that on there, and her fingers are already nice and warm. Her hand up here on her chest, right? So that way I can actually see the depth of the respiration, and I can tell when she's inhaling and exhaling. And then I can get a better assessment doing that. So let's start with 30 seconds. Okay, so I'm going to chart that her respirations were actually 18 breaths per minute. I'm going to chart the rhythm of her breaths. They were not labored. They were regular. And also as far as depth, I'm just going to chart that it was also regular. No exertion or anything noted. And then we're also going to make sure that we chart her oxygen, which was 98%. And once I am done with that, of course, I would wash my hands and also clean off any equipment. And that wraps up this skill. Thank you. Hello, my name is Shay. I have Monica here, this lovely nurse, and we have just washed our hands. We are going to be assessing our patient's radial and apical pulse simultaneously. So now she is going to find the apical, and I will find...
Are you okay with me going ahead and bring this pulse up underneath?
Okay.
Thank
so
you.
I'm gonna check here. And then once I find it, I will let you know.
Okay.
You found it?
Yes, ma'am.
And I have found mine. So we're gonna reset and then ready?
Uh-huh.
Go. Okay. And I've got 81 again.
I also got 81 again.
Okay. We have done this skill about 3 times. And so I'm going to make sure that I chart that the rate, rhythm was all within normal range, right? Because 81 is within normal range. The rhythm was regular, and also I would say that it was a +2 as far as the strength is concerned. And then that is going to be that for the end of this video. Okay, moving on to the apical and radial pulse, what I'm going to do is I'm going to have the patient, or I'm actually going to ask the patient to sit up 5 minutes before I assess her apical and radial pulse. And then I'm also going to have her get into a gown so that way I can provide maximum privacy for her. All right, are you okay with me lifting your gown up?
Mm-hmm.
Okay, here we go. So we're going to start with the apical. We're going to assess for 1 full minute using the diaphragm of the stethoscope. Okay, I'm just going to have you lift up here. All right, we are starting now. Okay. So in this case, for her apical pulse, I just got 78. I'm going to make sure that I'm charting this and the rate, rhythm, and strength. So the rate is within normal range. The rhythm sounds regular. And the strength, I would say, is a +2. So it's normal. Now I'm going to, and before all this would have begun, I also would have washed my hands and put on my gloves, just an FYI. So now what we're going to do is we're going to assess her radial pulse. Okay. I'm going to find it, and actually we've been practicing. I actually want to do mine for 1 full minute just because that's where I'm more comfortable in that time frame. There we go, and I found it. So I'm going to start my timer for 1 full minute. Okay, so for her radial pulse, I got 73. I am going to be gathering Lindsay's height and weight. I'm going to start by washing my hands. I'm going to have my patient take off her shoes. Can you get you to take your shoes off for me here? All right. I'm going to bring her over to the height scale. I'm going to have you stand straight up. And what I'm going to do is I'm going to just gently place that right above your head, making sure it's gently touching. And so what I see is I have 5 feet, so she's a little bit above 5 feet, and then she's got 1, 2, 3, 3.5 inches. So that's going to be 63.5 inches. So I'm going to make sure that I'm documenting 63.5 inches. Then I'm gonna bring her over to the scale and I'm gonna get her weight. So before I have my patient step on the scale, I'm actually gonna zero this out. That way it's touching the bottom. Okay, I'm gonna have you step on. So this, when it hits the top, that lets me know we need to be moving this. So we're gonna get it to about 150. What we're looking for is this weight to kind of balance, and then what we do is we add it based on, these are the hundreds, and it looks like she's gonna be 215. So 215 pounds. Go ahead and step out for me. And I'll bring this over here. So we're going to convert that. So I got 215 pounds. And then I'm going to divide that by 2.2. And so what I have is 97.7 kilograms. And I'm just going to document that. I'm going to wash my hands. And also I would have, I don't know if I said that in the beginning, but I would have washed my hands and put gloves on in the beginning. And that is going to be that for those skills. So that's a wrap. All right.